Welcome to Level Up. We are so happy to have you back with us again today. Today, in the video that you will be able to watch, Dr. Neil Nedley will explore the relationship of mental health and the immune system. You are not going to want to miss today's presentation. I'm Dr. Leila Lewis. I'm a board-certified obstetrician and gynecologist. I'm also the medical director for Adventist World Radio 360 Health, which is the sponsor of Level Up, an amazing YouTube program where we bring you up-to-date information that is scientifically proven and sound. Well, today's presentation, if you're joining us for the first time, is actually an excerpt of a symposium that we did a few months ago. At the beginning of the COVID outbreak here in the United States of America, a medical symposium took place, and one of our main speakers was Dr. Neil Nedley. Dr. Neil Nedley is an internal medicine specialist. He's also the president of Weimar Institute in Northern California that focuses on holistic health. He has a special emphasis in looking at the relationship of the mind as part of the holistic health of the body. Well, Dr. Neil Nedley has some amazing information that he's going to present. It was so well received a few months ago that we wanted to again share it with you today. If you have not yet had an opportunity of subscribing to our channel, we ask that you do so right at the bottom of your screen right there. Again, we hope that you will enjoy today's presentation. Dr. Nedley, share with us how open space and ultraviolet radiation can help us holistically in our mental health.
Thank you very much, Leila. Well, fortunately, even in all the restrictions of COVID-19, the government agencies have not shut down mental health centers. And even right now at Weimar Institute, we're running depression and anxiety recovery programs with live patients who have traveled here and been allowed to travel for their mental health. But actually, anxiety rates have gone up considerably, as you might guess, as a result of COVID-19. In fact, some of the patients traveling here were very specific at making sure they changed their planes from the East Coast to the West Coast to places that had the lowest rates of COVID because of the fear of contracting that even in travel. And we know from medical students as well that when they have their 3-day test period, not only does their anxiety go up, but their innate immune system goes down considerably. And so emotional health is key with neuroimmunology of having a healthy immune system. Well, UV radiation does produce vitamin D in the skin, and it's synthesized by UVB radiation that was mentioned earlier. And the efficiency of production depends upon the number of UVB photons that penetrate the skin, a process that can be curtailed by clothing or excess body fat. This is why obesity in some degree is related to less immunity, because you're able to make less vitamin D from the sun. Sunscreen and the skin pigment melanin also have a role to play. For most white people, a half hour in the summer sun in a bathing suit will initiate the release of 50,000 units of vitamin D into the circulation within 24 hours of exposure. A more tanned individual with the same exposure will have 20 to 30,000 units, and a person who is dark skinned will have 8 to 10,000 units. And so you can see the difference that pigmentation can make. Ultraviolet radiation not only helps with vitamin D levels, but it also increases blood levels of natural opiates called endorphins. And this is why sunlight actually has more benefit than just the vitamin D aspects. There's several multiple aspects that make sunlight a superior way of getting your vitamin D than through a supplement, if at all possible. Now, there have been studies done regarding vitamin D and depression. This was a study in adults 18 to 65, and vitamin D was found to be lower among participants who had either current depression or recurrent depression compared to controls. And it was also associated with symptom severity and worsened 2-year outcomes. Then a study was done in college women. These were undergraduate women from the Pacific Northwest. And this was published recently, and it showed more than 1/3 of participants had depressive symptoms, even though they were considered healthy. Almost half of those had vitamin D insufficiency, and depressive symptoms were actually predicted very well by the vitamin D levels. One of the quotes of the study showed vitamin D deficiency and insufficiency occur at high rates in healthy young women, and lower vitamin D3 levels are related to clinically significant depressive symptoms. Lower levels of vitamin D are also associated with clinically significant symptoms of depression in otherwise healthy individuals as well. Now, vitamin D has receptors. There are vitamin D receptors distributed in brain areas as well. And this, of course, involves emotional processing and affective disorders. Vitamin D is also very important in regulating serotonin synthesis via transcriptional activation of tryptophan hydroxylase 2 gene. And this is important in getting our tryptophan to go over into 5-HTP and serotonin. And as Dr. Schwalt mentioned earlier, it impacts innate immunity and the production of pro-inflammatory cytokines that in turn influence mood by activating the stress response. How well we respond to oxidative stress has a lot to do with our vitamin D levels. And then another important area that involves sunlight as well as darkness that's very important. And in fact, there's been a whole article just published last week about how melatonin can help us significantly, potentially with COVID-19, is this pineal hormone. It's a key pace setter for many of the body's circadian rhythms. It also plays an important role in counteracting infection, inflammation, cancer, and autoimmunity. Melatonin actually suppresses ultraviolet radiation-induced skin damage. So if we are exposed to ultraviolet light, we'll have actually less skin damage if melatonin is circulating. And when people are exposed to sunlight or very bright artificial light in the morning, or 480 nanometer wavelength blue light, which doesn't have to be so bright if it's the 480 nanometer wavelength, their nocturnal melatonin production will occur sooner and they enter into sleep more easily at night. There's an advantage of early to bed, early to rise. And it turns out that when we are exposed to sunlight, we have a much greater tendency to go into this early to bed, early to rise mode. And we're getting a nice spike in our melatonin earlier and can actually have double the output of melatonin at night. The melatonin rhythm phase advancement caused by exposure to bright morning light has been effective against insomnia, premenstrual syndrome, and seasonal affective disorder as well. And then, of course, serotonin is augmented with light. Moderately high serotonin levels result in more positive moods and a calm yet focused mental outlook. Seasonal affective disorder has been linked with low serotonin levels during the day, as well as a phase delay in nighttime melatonin production. And so if we have low serotonin, and of course, we're not going to get that nice spike of melatonin as early in the evening for a couple of reasons. Mammalian skin recently has been shown to produce serotonin. We used to think serotonin was only produced in the gut, enterochromaffin cells, and also in the pineal gland and retina. We now know it can actually be produced in the skin, and it can transform it into melatonin also in the skin. And there's many types of skin cells that express receptors for both serotonin and melatonin. Well, with our modern day tendency for indoor activity and staying up well past dusk, nocturnal melatonin production has been found to be typically far less than robust. Dr. Russell Ryder, who's the University of Texas Health Science Center, and is a melatonin researcher, says this: the light we get from being outside in a summer day can be 1,000 times brighter than we're ever likely to experience indoors. This is part of the problem of many people with COVID-19. They're fearful of getting out of their house, period. And we want to encourage them, especially with this program. Hopefully you'll want to get outside into bright light, into blue sky, and into fresh air and actually start working on the outside of your home. Dr. Reiter goes on to say, for this reason, it's important that people who work indoors get outside periodically. Moreover, that we all try to sleep in total darkness. This can have a major impact on melatonin rhythms and can result in improvements in mood, energy, and sleep quality. And increasing melatonin through light will improve depression. Interesting, the melatonin pills can improve your sleep, but they can actually induce apathy, where if we're getting it naturally, we will actually improve our apathy as well as our sleep. But what about if you can't get that bright light in the morning to set your circadian rhythm? This has been studied now using that 480 nanometer light box. It's a medical grade light box made by Philips. And there was a randomized controlled trial in which one group was given this blue light and the other were given a placebo light, a pale red light that has no known effects. And as a result, they found some significant differences. 3 weeks after the therapy ended, more people in the light therapy group were considered treatment responders, meaning their depression scores had dropped by at least 50%. And of the light therapy patients, 58% were responders versus just 34% in the control group. And we also noticed that if they had the Philips Lightbox therapy, they had that steeper rise in evening levels of melatonin, which helped them promote sleep, and it helped them to go to sleep earlier. And their cortisol levels, the stress hormone that can suppress the immune system, actually went down. And the study's author, a psychiatrist, mentioned, I think bright light therapy definitely now deserves a place in the treatment of major depression. And this is something we will do with our wintertime patients here. They actually get this light therapy every morning. It helps to set their body clock, and they will notice significant differences in their sleep quality within a week. And one of the problems of our screen age is screens actually reduce melatonin. In fact, a lot of people look at e-readers to read books before bedtime. And this was a crossover study. And interestingly, the researchers found those reading on screens were less sleepy in the evening, took longer to fall asleep, and had reduced levels of melatonin. But when they crossed them over, they noticed something different. The blue glow, that is, the blue light is good in the morning, not so good in the evening. It actually disrupts your circadian rhythm in the evening, coming from Kindles or iPads. And they took nearly 10 minutes longer to fall asleep after reading an e-reader. Lower amounts of rapid eye movement sleep, which actually helps our frontal lobe, the control center of our brain, later timing of their circadian clock, and their next morning alertness was reduced. They didn't have that energy in the morning. And the study's author from the National Academy of Sciences said screens can have an extremely powerful effect on the body's natural sleep pattern. So we would encourage you to look at screens primarily not before bedtime. One of the concerns is the WHO in 2013 stated that the average person now spends 90% of their time indoors. That is worldwide. And a recent study showed a quarter of Americans spend almost an entire 24 hours without going outside and downplay the negative health effects of only breathing indoor air. In fact, 25% of Americans only get outside 2 times: when they're going from their house to get in their car to go to work, or when they're going to school, and of course, coming back. And so for many Americans, that's the only time, a quarter of them, that they're outdoors. 77% of Americans don't believe that breathing air inside is any worse than pollution outside, although the EPA showed us it's 2 to 5 times more polluted inside than outside in general. And humidity, mold growth, inadequate temperature, and being in close quarters with other people are all cited risks associated with poor quality indoor. And as Dr. Charles Marcel mentioned, negative ions are one of the secrets of this fresh air. It's generated from radiant or cosmic rays in the atmosphere. Sunlight, including UV light, produce these negative air ions, as well as lightning and shearing forces of water. He mentioned the beach and waterfalls, called the Lennard effect, that are producing these negative charges to our oxygen and ions. And of course, plant sources like evergreen trees also have an effect. Negative oxygen concentrations exceeding 1,000 ions per centimeter cube is what is regarded as the threshold value for fresh air. This is something that we haven't been able to generate indoors so much, and outdoors is really better on this front, at least for now, although we're looking at maybe negative ion generators that could have some positive effects. What have NAIs, or negative ions, been shown to do with mental health? Significant increase in performance of mirror drawing, rotary pursuit, visual reaction time, auditory. Your learning actually goes up with negative ions. It can alleviate symptoms of seasonal affective disorder, and it can improve symptoms of mood disorders, comparable to antidepressant non-pharmacotherapy trials in this study. Negative ions also have shown effective treatment for chronic depression as well. And in one study were shown to help regulate serotonin, one of the methods in which it could be working. Then I'll close with two interesting Dutch studies. One of 300,000 adults and children, and those living near more green spaces. This would be parks, green trees, areas where you can roam, maybe forests, those type of things, had lower rates of 15 different health conditions, and the link was especially strong when it came to two of those conditions, and that is depression and anxiety. One of the reasons why we run a mental health program here is the 15 miles of trails in the forests that are close by and all of these evergreen trees in Denmark. But this one was published more recently, and this was an amazing study. I've never seen a study quite like it, where all of the diseases in Denmark are actually graphed by not only, name, but they kept the name out, but residence, where you live. And they looked at the government healthcare diseases of all the different addresses, and then they imposed satellite imagery to look at the actual green spaces. And it was the largest investigation of the association ever between green spaces and mental health. And growing up near green spaces was associated with a lower risk of developing psychiatric illness in adulthood by anywhere from 15% to 55%, depending on the specific illness. For instance, alcoholism was most strongly associated with lack of green space, and the risk of developing learning disabilities turned out not to be associated with green space. But depression and anxiety also were related. And so this is probably the largest study, and one that seems to be very much associated with the fact that mental health is improved by being outside, being near green spaces, and getting into the green spaces. And it can help us in multiple ways, as has been mentioned. Leila?
Thank you so much, Dr. Nedley. You've really brought the picture to us now of the physical combined with the mental, emotional, and the effects that green space or open space and ultraviolet radiation play on all three of these aspects of health. But there's one other aspect to complete the circle, if you will, of the entire person, and that's spiritual healing. We have a full picture, and I am so excited to welcome our final guest, Dr. Mark Finley. Dr. Mark Finley is an international speaker, and he's also the special assistant to the General Conference President of the Seventh-day Adventist Church. Dr. Finley, can you share with us how, again, we're looking at this whole person from a spiritual perspective, and how even things such as ultraviolet radiation and open space play a role in our spiritual well-being as well?
Thank you, Leila. It's exciting to see the evidence for hydrothermal therapy, the research that's been done in the area of fresh air, ultraviolet rays, and sunshine. But one might ask the question, do we have adequate research that demonstrates that faith makes a difference in our physical, mental, and emotional, social well-being? Are there studies that are evidence-based that help us to understand that faith is a valuable tool, a valuable resource in the restoration of health? From 1872 to 2010, there were about 1,200 studies done in the area of religion and health, faith and health. When you go to 2010, from 2010 to 2020, there have been 2,000 studies in this area. In fact, about 90% of all medical schools in the United States today have some kind of course in religion and health. What are these studies revealing? What kind of evidence are they bringing forth? Are people who have faith healthier than people that don't have faith? What role does faith play in this holistic approach to health? It's kind of interesting, too, that in 1946, the World Health Organization talked about health as not simply the absence of disease, but as complete physical, mental, and emotional wholeness. And that consisted, that went up for years, for decades. But recently, the World Health Organization has included in their comprehensive approach to health spirituality. So let me share with you very simply 3 things that the research shows us about faith and spirituality. 3 things that these 2,000 studies since 2010 show us. Number 1, faith leads people to make better lifestyle choices. When you look at all the data, the people that have faith will tend to smoke less, they'll tend to have less alcohol consumption, they'll tend to do less drugs, harmful drugs that is, and they tend to exercise more, they tend to be more conscious for their diet. So one of the predictors of good health is people of faith. If you look at the blue zones, one of the places where people are living longer in the United States is Loma Linda, California. Why? It's a Seventh-day Adventist community, and there are people of faith that are there that have deep trust in God. How does faith help you to make better lifestyle choices? If you believe that you're created by God and that your body is the temple of God, that then leads you to care for your bodies in honor, respect, and worship of your Creator. So one way that faith makes a difference is that faith leads people to make better health choices. The second thing that the research indicates is this: faith leads people to be more optimistic and positive about their lives. Because they are more optimistic, positive chemical endorphins are released, and the inflammation from stress is decidedly less. So there's a relationship between faith, stress, inflammation. People with faith tend to have less stress, they tend to have less inflammation. Another thing about faith is when the research took a look at it, that when faith leads people to be more optimistic, it reduces the stress. Stress is one of the predictors, high stress levels of hypertension. It's one of the predictors as well of the whole concept of heart disease, with the leading killer in America. So what does faith do? First, it leads you to make better health choices. Second, it leads you to be more optimistic and more positive. There's something else. Faith leads people to attend church more. Now, that's pretty obvious, isn't it? But consequently, they have a better sense of community. And this sense of community produces positive health outcomes. Let me share with you just a few studies on this. Here's a study that I picked up today from the University of Berkeley in Southern California. It reported in 2002 the results of a 31-year study of 6,500 adults in Alameda, California. And the study said, now a 31-year study by University of Berkeley of 6,500 adults, that's pretty significant. This is what it says. People who attend religious services have significantly lower risks of death compared with those who never attend or attend less frequently. Then this next sentence was fascinating. Even if you adjust for age, health behaviors, and risk factors. In another article published in the Religious Involvement and U.S. Adult Mortality by authors Hummer, Rogers, Nam, and Ellison, they took a look at mortality rates, and they say frequency of religious service attendance was significantly associated with lower mortality risk for all population, as well as for each gender and racial group. Again, people of faith make better choices. People of faith tend to be more optimistic and positive. People of faith statistically will, of course, attend church more. Here's an interesting one. One article came out and said, it's official. If you regularly attend church, you're 29% likely to live longer. And that was a meta-analysis of dozens and dozens of studies. Michael McCullough of the National Institute of Healthcare analyzed studies that covered 126,000 people. These studies were published in Health Psychology, a journal of the American Psychological Association. And he said, we think this analysis pretty much establishes that this correlation of religious involvement and mortality exists. University of Texas did a real fascinating study. They looked at people who attended church regularly, people who occasionally attended church, and people who never attended church. And this is what they discovered. People who attended church regularly tended to have a life expectancy of 82. People who attended occasionally tended to have a life expectancy of 79. And people who attended not at all, they were non-attenders, tended to have a life expectancy of 75, 7 years younger, 7 years less, rather, in their life expectancy. What does this tell us? What does this research tell us? It tells us this, that faith is not pie in the sky by and by. That faith is not some illusionary thing for people that don't quite understand, that are intellectual ignoramuses. But to be honest with the data and take all the research together, human beings are physical, they're mental, they're emotional, and they're spiritual beings. And probing the spiritual, having a healthy relationship with God. What is faith? Faith is trusting God. As a friend well known, it's believing that I'm not a speck of cosmic dust, that I'm not merely skin covering bones, that I'm not a genetic accident, that I've been created by God. And that belief and understanding, knowing that in health and in sickness, in joy and in sorrow, when I face the challenges or the joys of life, knowing that that Creator is with me, that releases positive chemical endorphins that bring health to the entire system. Human beings are whole people. Thank you, Layla.